Hi, my name is Christy Miscati. In this video, I'm going to be reviewing assessments. Let's get started. I'm currently on my patient's progress note, and I'm going to click on this orange link that says assessment. To add an assessment to the patient's progress note, there are two different ways you can do this. One is from the classic search, which you're seeing now, and the other is from the smart search. So if I'm using my classic search option, on this left-hand side, I'm going to have a different tree listed. Now, I do apologize. I am in a fake database, so mine looks a little bit different than what yours does, is I do not have all these nice categories like you typically will have. I could choose the appropriate category over here, and then I can begin searching for my assessment here using either the code or by typing in the description. So my patient is coming in for pelvic pain. I can start typing in pelvic and it's going to filter it for me here. I'm going to go ahead and select this very top one. I can tell that it's an ICD-10 code because we have a green number 10 to the left. And then it's going to drop it in this middle section under selected assessments. On the far left-hand side, I have a P column. This stands for primary. The first assessment that you enter in the patient's chart is automatically going to make that selection for you. The next column that you have, PL, this is for problem list. So if I wanted to add this particular assessment into my patient's problem list, I could do so by checking this box. I can see the name of my code here. If there was a SNOMED code, I would see that listed, my diagnosis name, and then I have a couple of other additional boxes here if I want to add some more information like notes or if it's a high risk. On the far right, this X would delete any notes that I have listed here. So if I click on my notes box, and let's say I write something in here, click my close button, and now my notes are listed right here. But if I decide I want to get rid of them, I can just simply click this X. Yes, I want to clear the data, and it's going to remove it. My trash can icon would completely remove the assessment in its entirety. And then this star icon would be if I wanted to add it as my favorites. My other option is to turn on my smart search. I can do so by clicking on this settings gear icon right here in the right hand corner. I'm going to check the box for smart search. I already have mine selected to auto map to ICD, so I'm going to leave that checked as well. Notice my tree has now disappeared over here on that left hand side. And then I can begin searching for my assessment here using either a code or a description. For this example, I'm going to say my patient has vaginal discharge during pregnancy. Once I start typing it, it's going to start filtering in my different assessments. Notice this very top one is in blue. Once I select this one right here, it's going to bring me to an advanced ICD search window, so I can get a more specific code. I can choose the assessment, so maybe my patient is in their first trimester, and then this is the appropriate code that I want to select. Once I click my select button, notice I did get another additional pop-up window. This is for manifestation codes. So it's saying, although this is the code that I want, this assessment also pairs with it and it's going to automatically have it checked for me. If I want to add all of these codes, I'm going to just click my OK button at the bottom center. And now I have just added both of those assessments down here under my selected assessments category. If I wanted to switch my primary diagnosis, I can do so by just simply checking a different box. I also have the option to rearrange these codes, so I can drag and drop them and move them in a different order. Please note that whichever one is your primary will automatically go to the very top of your list once you close out of this window and view it on your progress note. A couple of other things I can do within this window. So we've looked at searching for our assessment from a classic search as well as a smart search. You also have these different buttons up here towards the right hand side next to your search box. You have your star icon. So I'm going to just clear out my current assessment I was searching for and click on my star icon. And this is going to show me any assessments that are in my favorites list. That way I can click on them and they would quickly add it to my selected assessments list. I also have the option to search by a previous diagnosis. So this is going to show me anything that was in my patient's chart previously. This is not provider specific. This is just in general any assessment that has been used for your patient. So same thing applies here. I can click on it to just quickly make my selection, and then it's going to drop under my selected assessments. My next option that I have, this PL button, this is for my problem list. So this is going to show me anything that has already been added into my patient's problem list. I can click on it and it's going to drop it down here for me as well. Notice it does automatically put a check mark here in that PL column, signifying that this is in the patient's problem list. Now, if I want to update or edit or add anything to my patient's problem list, of course I can do so right here by simply selecting one, or over here on this right-hand side where I have the button problem list, I can simply click on this button and it's going to show me all the problems that are already listed in my patient's problem list. Now, if my patient didn't have anything listed, I would have the option to choose no known problems selected right here. This doesn't apply for my particular patient as we already have problems listed. On the far right-hand side, I have an option to add ICD. So if I know of a problem that I want listed in my patient's problem list, but I'm not treating my patient for it today, therefore I don't want it a part of my progress note, I can just simply add it in right here. I can click on Add ICD. It's going to bring up a search window for me. So, for example, let's say my patient has hypertension. I'm not treating them for it, so I don't want it a part of my progress note, but I do want it documented here in the problem list. I can click on hypertension. This one's in blue, so I know I'm going to get that additional pop-up window for so I can get a more specific code. I'm going to select primary hypertension, and this is the appropriate code for me. Once I click my OK button at the bottom center, it drops underneath that selected assessments category. I can click the OK at the bottom right, and now I have added that diagnosis code to my patient's problem list. I also have the option in the top right hand corner to remove a diagnosis, copy it to medical history, or if applicable, I could change it to ICD 10 if it was not already listed there. To do any of these actions, I would just simply select the diagnosis code and then click the appropriate button. And now I've just removed that one. A couple other options that I have is I have some different columns listed here. So I could go in and fill out different items such as the status. I could change it to maybe confirmed or if it was unknown, etc. I also have my clinical status column. If this was something that was resolved or stable, I can choose the appropriate option. And then you can see when this problem was added, modified, and who modified it. And then if my status was changed to resolved, I would be able to see that date there. Once I click my OK window, everything will update for me. I can hit the X in the top right hand corner, and all the assessments that I just added are now going to be on my progress note. This concludes our video. Thank you for joining.